We're going to move now to Dr. Frederik Seelig. Frederik is Partnerships Manager for the Global Vector Hub at the London School of Hygiene and Tropical Medicine. And here his interests lie in building a global resource to build capacities in vector control and research, to exchange information and knowledge, establish a community of practice in vector control interventions, connect stakeholders to improve epidemic preparedness. Frederik has a background in medical entomology. He completed his PhD on the molecular ecology of Ixodes ticks in Europe and did a postdoc on the vector competence of hematophagous insects for the Schmallenberg virus. He's also worked in scientific publishing and science funding, including a 3-year stint as grants advisor in population health at the Wellcome Trust. He is co-chair of the RAFT Workstream 3, focusing on emerging and future mosquito-associated threats. Frederik, I'm going to hand over to you, and we look forward to listening to you share some valuable information with us. Thank you, Frederik.
Great. Thank you very much, Leo. Thank you very much for this kind introduction and for having me here today again as a speaker on this panel. Some of you may recognize me from yesterday's session hosted by ISNTD, and apologies for the double dipping, but those of you who weren't there yesterday, I hope you will learn a lot about the Global Vector Hub and especially the aspects of data sharing and the data repository. So yeah, as Leo had said, sorry, I'm just going back. As Leo had said, I'm the Partnerships Manager for the Global Vector Hub, and we are based at the London School of Hygiene and Tropical Medicine. Our project was funded originally by the European Union, arising after the Zika outbreak in South America in 2015-2016, when it became apparent that there is no single resource available that could provide information on vector control and vector data. So this is when our colleagues, and especially our director, Professor James Logan, started developing this idea for the Global Vector Hub as the one-stop shop for vector resources on vector control and vector research. So this was developed into collaboration with the Global Health Network at Oxford University and ArcTech, which is a spin-off company also based at the London School. Just to reiterate the problem that over 80% of the world's population is at risk of at least one vector-borne disease, and 70% of the global burden of communicable diseases is due to vector-borne diseases. And apologies for these slightly outdated figures, but I'm afraid they haven't changed very much since we used them last. So that is an estimated 400,000 to 450,000 people die of malaria every year. And very importantly for this meeting now is an estimated 390 to 400 million cases of dengue fever every year. So this clearly dwarfs many other diseases that we're talking about in terms of vector-borne diseases. So, and Leo had alluded to this already in the introduction, the Global Vector will be instrumental in helping to eliminate vector-borne diseases worldwide, by bringing together researchers, health workers on a very large scale, cutting across disciplines, breaking down silos, and connecting people from different disease and vector branches. Again, as Leo had described, we want to be the first port of call for different stakeholders. We want to build a community of practice, really hosting bespoke educational material and training packages. We are building a platform for transparent data sharing, and crucially, we want to build capacity and maximize preparedness for outbreak situations. And this is clearly something that has become even more apparent through the COVID-19 pandemic. And I will mention this in a moment a bit in more detail. We also want to connect professionals working in the field of vector control and vector research by building a network function. And eventually, the overall aim would be to reduce the incidence of vector-borne diseases. So, as I had said, in the course or in the context of the COVID-19 pandemic, we decided last summer to launch an earlier version of the Global Vector Hub already, to provide rapid access to key types of information for anyone working on vector-borne diseases and vector control, and who may otherwise have reduced access to their regular streams of information, let's say from governments and ministries of health, and who are also looking for dedicated information packs, which is why we launched the earlier version, and this has been quite popular already. So this beta version already includes resources and networking feature, and you can upload your data, and is very much focused on capacity building and strengthening systems for vector control. It also includes a global directory of training courses in medical entomology that was developed in collaboration between the Global Vector Hub and ArcTech, and together with WHO TDR. And I will explain this in a little bit more detail also in a second, because I think this is also quite fundamental for aims of building capacity in medical entomology. As I said, we have already a large repository of resources available, and the fully functional version, which we're aiming to launch this July, will have even more improved functionality in terms of searchability, so you can find different types of information such as education materials, vector control guidelines, research tools, and extensive information packs, and support material for staff to train on the control of vector-borne diseases. This is just to give you a quick overview of the most popular documents that are currently being accessed on the Global Vector Hub. And I think you can see there's quite a wide range of different types, so ranging from the WHO fundamental document, Global Vector Control Response 2017 to 2030, which underpins many of the decisions that we have been taking when designing the Global Vector, because it's such a crucial document. I can only always remind everyone to revisit this document and consider the recommendations spelled out in it. It's really a great document, and it's quite important. Then we conducted a survey on the impact of COVID-19 on vector-borne disease research and control operations last summer, and the preliminary findings are shown here. And I think the third document, which I think is interesting for this audience, is a pictorial identification key for important disease vectors in the WHO Southeast Asia region. And then we have some more technical tools as well, in terms of how to plan entomological surveillance, but also how to develop laboratory capacity for good lab practice certification that was developed together with IVCC and the Liverpool School. As I said, we also have a worldwide network where users can first need to register, and then they can share data, information about their fields of expertise. They can participate in discussion forums, and they can collaborate in future exciting projects. So this also allows users to indicate their institutions. So for instance, any relevant government, academic, or not-for-profit organizations, likewise any industry-led organizations and research institutes. And we also have further sections on funding and employment opportunities, training opportunities as well. And this really is aimed to allow for improved capacity building and improved staff retention, because this is something that we've gathered when talking to stakeholders from across the world. Is the challenge not only of long-term funding, but also, excuse me, of really maintaining staff once they had been trained at, say, at the first level, and then there's no further employment opportunity, or they do not see a longer-term perspective in medical entomology or in vector control, so that then they may move on to something else. And obviously then you would lose all the training that you've invested in this personnel already. To follow on the theme of the impact of COVID-19 of global vector control efforts, we also hosted a high-profile workshop last year together with the Global Health Network again, which was attended by over 400 participants from 60 countries. And we had a really high-profile, high-caliber group of panelists, including Dr. Raman Velayudan from the WHO, Dr. Damaris Matoki from KEMRI in Kenya, Dr. Grayson Brown from the Puerto Rico Vector Control Unit, and our own director, Professor James Logan. And you can also watch a recording of this video following the link. We were also heavily involved in developing a free, massive open online course, MOOC, entitled The Global Challenge of Vector-Borne Diseases and How to Control Them. This was also launched last September, I believe. Again, this was quite a large-scale development together with ArcTech, other colleagues at the London School, with colleagues at the IVCC and the Liverpool School of Tropical Medicine, and it's hosted on the FutureLearn platform. But we have also some of the material available on the Global Vector Hub. So in the first round, we had over 4,500 registered users, and the feedback from stakeholders, particularly in the mosquito and the vector control community, has been extremely positive, with requests for repeats, and we were talking about future collaborations in this area. Again, this going to the field of capacity building. As you can see, this is quite an overarching theme for us. You can still watch or access a lot of the material either on the Global Vector Hub, or if you follow this link on the FutureLearn platform. And as I had said, we also conducted a survey on the impact of COVID-19 on global vector control efforts and how different groups of stakeholders and how different sectors are affected, but also which vector-borne diseases are mostly severely impacted. Also identify common narratives and experiences, find knowledge gaps, and make recommendations to improve future epidemic preparedness. So if you go to the Global Vector Hub website, you can also download the report there and read the summaries. Just briefly wanted to highlight the key findings here was that a large proportion of the participants reported severe impact on their own work. And about 57% also felt that COVID-19 affected vector-borne disease research and control operations in general, greatly or extremely. So as you can see, this is quite a severe impact that the pandemic was having, and I would assume still having at this time on global vector-borne disease control. And then lastly, we also launched the Global Directory of Medical Entomology training courses that was developed in partnership with a special program for research and training in tropical diseases, short TDR, and ArcTech. And again, this will help building capacity for scientists in combating neglected tropical diseases such as dengue. And at the moment, we have 126 training courses listed on this directory. They are from 32 different countries and in 10 different languages. And would invite you all to have a look on our website. We would kindly ask you to register, and then you can access this course directory. Have a look if there's anything that might be of interest for you, if you're a junior researcher or interested in specializing in medical entomology. But also if you work at an institution and your institution is already running a course in this area and it's not listed, please do get in touch. We are currently finalizing the SOPs together with TDR, and we're always looking forward to feedback and recommendations to add new courses to this list. And then finally, so this is perhaps the focus of my presentation now, is the Global Vector Database. So this, in the fully functional version at least, this will be a searchable database with an integrated map feature, and it will provide hopefully real-time and relevant vector surveillance data, control and research data, and combine this with relevant information about any country. So these information types might, for instance, be who are the key contacts, who are the key stakeholders and organizations conducting vector-borne disease research, but also vector control in any area. So these might be international organizations such as the WHO or PAHO in South America, but also who are the main contacts at the Ministry of Health? Are there any NGOs active in this field? Who should I be talking to if I'm really interested in a specific area, let's say working on dengue or working on leishmaniasis or malaria? So really combining the different aspects of the Global Vector Hub in terms of data and information and networking. So the database allows for the collection and interpretation of very specific vector data, provided by researchers and labs and field sites. At the moment, as it stands, we have mostly collected data from the published literature, including 29 different data sets from publications, mostly focusing on Aedes vectors in South and Central America. This is again mostly due to the historical background, how originally the global vector was conceived. As I said, it arose from the Zika outbreak in 2015-16, and this is sort of the historical background of the project. But in the longer term, we're aiming to become truly global and have an outreach in the Southeast Asia region as well as in Africa. I should also point out that at the moment, a lot of the collaborations with our partners in Latin America have been put on hold. Latin America is severely still affected by the COVID pandemic, and they are still struggling to carry out routine surveillance and vector control work in many places. And obviously, a lot of the attention and the resources have been shifted from these routine operations to containing the COVID-19 pandemic. As you may have read, for instance, that there's an ongoing dengue outbreak in Peru, and we think that there should definitely be a focus or a shift, reshifting the focus back towards fighting vector-borne disease outbreaks. So I thought I'd give you a few examples of the type of data that we are planning to host on the Global Vector Hub. So this would be the example of Colombia, and where you can, for instance, filter for the vector abundance of any specific type. As I said, we initially will focus on Aedes aegypti, and here you have different clusters of abundance data, and then you would be able to zoom in on the map and have it into further detail and really finer granularity. You can also download the entire data set for any selection and then have it as a CSV file for your own analysis. Further types of information that we're hoping to provide, depending on the quality of the available data, are insecticide resistance. And I think this is really crucial for any vector control operations. So for instance, here again, keep coming back to the example of Colombia. You really see this clear gradient almost of resistance. So in the Caribbean provinces in the north, you will see a lot of cases of confirmed resistance against malathion, whereas further up in the south, in the Pacific and in the Andean regions, this has normally not taken place yet, with the exception of this one case of suspected resistance here in the Andes. So again, this is really depending on the quality of the data that we receive. And again, this ties in with the capacity building aspect of the Global Vector Hub, where we also provide guidelines and instructions, such as those documents from the WHO or the CDC, how to test for insecticide resistance of any caught mosquitoes and other vector species, how to really have a very standardized way of carrying out these tests, and how to report the data then in a standardized format. And then hopefully this will then bring together different strands of information and thereby allow stakeholders and decision makers to really make evidence-based decisions using the best data available. And as I said, we had started with the Zika virus outbreak, and this is obviously in addition to dengue as the major vector arboviral disease. So this is testing mosquito samples for the Zika virus, and as you can see here, most samples have not been infected, and I believe this is from 2018, but I'm not entirely sure. But again, this is always very important to keep monitoring the vector samples that you keep collecting for known pathogens. And finally, and this might be a little bit more of a more basic research interest is the blood meal host identification, where this has been carried out. And again, nowadays with improved sequencing techniques, this is becoming more and more common. And I should add that these data are taken from the vector-based database, which is always listing this information as well where available. And again, as you can see here, there's normally mixed blood meals in all samples tested, but there are only very few samples available because it's not perhaps something that routine surveillance operations would look for. And then perhaps moving on from there, just to take a step back and look at other developments in the terms of vector control, which I think are also quite important because they do need to make use of surveillance data. So you've probably all read about the recent groundbreaking study, the randomized control trial in Malaysia, testing Wolbachia in Indonesia, testing the impact and the efficacy of Wolbachia infected mosquitoes to control dengue. And the trials are really astounding in their effectiveness. They really show a 77% reduction in dengue incidence and, an 86% reduction in dengue hospitalizations in the treated areas. And again, this could only be done if you combine this with baseline surveillance data in these areas for the entomological sites. And again, this highlights, I think, the importance of having really high quality surveillance data in terms of vectors to carry out really high quality and impactful and meaningful studies in the future. The same applies to the combination of contact tracing with targeted indoor residual spraying. I think a very promising aspect that is pursued especially in Mexico under the guidance of Gonzalo Vázquez Procopec in Mexico, and they've also been achieving very interesting results there. Again, highlighting the need for good baseline surveillance data for these studies. And now, if you excuse this dengue focused forum, I am going to shift the focus slightly to a different type of vector, which is Anopheles stevensii, which is very common in Southern Asia, on the Indian subcontinent, but over the last few years have also been reported in the Horn of Africa, in Sudan and surrounding geographical areas. So in 2019, the WHO issued this vector alert on the invasion and spread of Anopheles stevensii. And I'm citing here a few examples from the recommendations from this alert, recommending that countries in and around the Horn of Africa should update the existing national vector surveillance strategies and guidelines to integrate Anopheles stevensii and actively conduct surveillance for stevensii in urban and peri-urban areas. And then they give a few more examples of the specific urban breeding grounds. And this is highlighted here, given the overlap in the breeding sites with those of AIDA's national malaria control programs are really encouraged to seek close collaboration with national entities responsible for the control of arboviral vectors, again, as envisaged under the GVCR 2017-2030 document. So again, there's really this overlap between different groups of stakeholders and breaking down of silos. And again, recommending that any new detection of stevensii should be reported to WHO because they can display it in the malaria threats map. And this is an example here of the malaria threats map. As it says in the name, it's very much focused on malaria. But I think this really gives you a very good indication of reports of this invasive species in the Horn of Africa, and combine this with reports and recommendations. And we've been told by WHO, by the local experts working on this resource, that they're also planning to expand this to AIDES and AIDES vector surveillance at a later stage. So this is obviously quite relevant, and we are planning to collaborate with them quite closely on this. So this is just again to highlight the need for really systematic vector surveillance being conducted in a routine and in a really standardized fashion, and that additional funds and resources should be made available in the interest of public health. This is not just an academic exercise, but really is necessary to contain the spread of any future vectors of human diseases. So as I said, we have been talking to WHO and with admin in the Asia Pacific region, with TDR, with many mosquito control associations and other networks. So we are always open for new collaborations, and we're happy to share any resources, any data that users may have. And we always invite people to get in touch and talk to us. So this is our team, headed by Professor James Logan, who is now the former head of the Department of Disease Control at the London School. He's also the director of the Global Vector Hub and also the founder and director of ARCTEC, and the rest of our amazing team. And yes, I would invite you all to follow us on social media, particularly on Twitter, for any rapid updates. And we do ask you all, do register yourself, your work, or your organization by following this link. And also, if you have any data or any other resources you would like to share, please do contact us either by sending us an email or going to the website and go to the contact form there. And with that, I come to the end. Thank you again. And thank you to our funders, the European Union and the BBSRC, and our colleagues at ARCTEC and the Global Health Network. And thank you all for listening. Thank you.